I'll never forget, those words. He's unresponsive,
Nearly 2 years ago, Trish Bisson's son, CJ Holowak, collapsed at work and died at just 33.
I'm confident that it was Kratom that killed him.
Sold readily at smoke shops, convenience stores, and gas stations, Kratom is derived from a plant from Southeast Asia and often marketed as a supplement to boost energy, manage pain, and even possibly help kick addictions. It can be bought in liquid, tablet, or powder form. Small doses, the DEA says, provide a stimulant effect. High doses, a sedative effect. And it's big business, forecast to be a nearly $16 billion industry by 2032. Bisson says CJ was taking a concentrated liquid form for pain after breaking his arm in 2021.
Did he say it was helping, or what were your thoughts?
He did say it was helping. He wrote in that text, it's helping.
An autopsy found CJ died from cardiac arrest due to mixed drug intoxication, including Kratom. The other substances in his system, Bisson says, were doctor-prescribed medications he'd been taking for years.
We found, I would say, hundreds of empty bottles of Kratom.
She's now suing the maker of the Kratom her son took and pushing for a bill that would prohibit the sale of Kratom in New Jersey, like in these 6 states and Washington, D.C.
Take it off the shelves. It's as simple as that.
But down in Houston, Madeline Scalar credits Kratom with saving her life. She turned to Kratom to deal with chronic back pain after stopping prescription opioids.
I have degenerative disc disease in both my neck and back. Taking high-powered opioids, my pain level on a good day would be a 6, but when I was using Kratom and first got started with it, my pain level seriously goes to a 0.
I wouldn't want my kid going into a gas station, picking up a concentrated extract and chugging the whole thing.
Professor Chris McCurdy of the College of Pharmacy at the University of Florida has studied Kratom for years. He says in low doses, it's about as addictive as coffee, but there isn't enough research on these new higher dose products. CDC data from 2023 shows 37 states and Washington, D.C. had 1,151 overdose deaths in which Kratom was detected. But Kratom's contribution to these deaths is unclear. The FDA doesn't regulate it, but warns the public against the use of Kratom for medical treatment.
The products are on the market because they are treated at this time as a food or a dietary ingredient.
The American Kratom Association accuses the FDA of a relentless campaign to keep Kratom off the market rather than ensuring consumer safety. The FDA did not respond to our request for comment.
Her having her share her experience with Kratom. I met her on TikTok.
Scalar, who hosts a podcast about Kratom, says she's far from the only success story. But even she agrees more laws are needed. For Trish Bisson,
my son died and he shouldn't have died.
It's just not worth the risk.
Really fascinating reporting. You mentioned there that the FDA, they declined to comment, but where does this substance stand with federal regulators?
Yeah, the interesting thing about this is so many people we talk to on both sides of the issue want more federal regulation for this. They're asking for the FDA to step in here. We did reach out to the FDA. They were working on a response, but the pause for health agencies to communicate with the public has put the brakes on that, so we did not actually get a response from the FDA. The DEA, though, about a decade ago was considering putting Kratom as a Schedule I substance on their list, putting it with heroin and ecstasy and those types of drugs. But they backed off of it because they received so much backlash. People we talked to, including the experts, say there is a potential for some medical benefits here, but more research is needed and more regulation as well.
Steven Romo, thank you so much.
Thanks for watching. Stay updated about breaking news and top stories on the NBC News app or follow us on social media.